Hello and welcome. We're so glad that you're joining us today. Thank you for being here for another Facebook Live update about COVID-19 right here in Berrien County. I'm Jillian Conrad. I am with the Berrien County Health Department, and I'm joined here today with Nicki Britten, who is the health officer for the Berrien County Health Department, and Dr. Loren Hamel, the president of Spectrum Health Lakeland. Thank you both so much for being here as well. So it's been a few weeks now since we've had one of these updates, and gosh, a lot has happened since we last met. So we've got a lot to cover today. Let's just jump right in. Nicki, will you give us an overview of some of the trends with COVID-19 that we've been seeing as far as transmission goes here in Berrien County?
Yeah, thanks, Jillian. So for the most part, we have continued to see a decline in the number of cases. Where we are right now does fairly closely mirror where we were last fall before we started to see the big surge throughout October and November. We, over the last couple of weeks, have been averaging anywhere from about 17 to maybe about 25 cases on average per day in Berrien County. Now, over the last week or so, those cases have started to climb just a little bit, but we use that term relatively. So the cases have increased, but we're still at an average of about 25 cases per day. Now, you always need time to know if a trend is really a trend or if it's just a blip on the graph. We do know that we are seeing data from elsewhere in the country that is showing that there are these similar starts of some creeping up and some inclines in the number of cases. It's hard to know what exactly that will amount to. And that's part of the reason it's really important for us to remain really diligent with every protective measure we have in our toolbox. Vaccination is a big one, and we're going to talk a lot more about that today, but we also have to remain mindful of maintaining social distance, wearing a mask, avoiding close contact and being in large groups of people, and just a lot of those things that we've been doing for the last year still remain really important. Our percent positivity has crept up a little bit. We're up above 6% now, where we were at or below 5% for a period of time. So none of these at this moment are causing significant alarm, but we do need to remain vigilant in what we're doing, especially as we're getting to what could be towards the end of this if vaccination rollout continues at the pace that it's going and continues to accelerate. There is some light at the end of the tunnel. We just have to make sure that we don't throw ourselves off course by starting to get sloppy. When spring comes, we really know, I understand that feeling. We want to have some changes in our routine. We want to start doing some things we haven't done for a long time. And I just urge us all to continue to be patient and be cautious and be smart.
Absolutely. So Dr. Hamel, tell us about what's going on at the hospital, and do you have any observations on vaccinations globally?
Sure, thanks, Jillian. Well, the hospital's about the same as it was last time we've talked. You know, we often have somewhere between 10 and 15 folks in the hospital. We will have a few that are sick in the ICU, although not today. That's been fairly stable. We are watching the trend lines. We're watching what's happening in other hospitals. There are hospitals in Michigan that were below 10, and now they're up around 40 or 50 again. So that just underscores we're okay for now, but please be careful. We want to keep you healthy and those you care about healthy. And we want the mortality rate from here on in Berrien County to be 0. And we know that's not going to be the case, but the closer we get to 0, the happier we are. Now, the good news is the vaccine is becoming more plentiful. As you've heard, President Biden suggests we're going to have enough for everybody in May. I hope that transpires without a glitch. It looks like we're getting much more in the next few weeks than we had in the last few weeks. We long for that. We're liberalizing, as you know, the folks that are getting the vaccine. About half of Berrien County that is eligible for that vaccine has been vaccinated between the health department, Lakeland, and others in that effort. You probably have heard there's one vaccine that there's some concern about in Europe and England. You know, that's the AstraZeneca vaccine. We do not have that in the US. That has been developed by Oxford and has been given in Europe and England, about 16 million doses given. And they've had 11 cases of blood clots. That's less than 1 in a million. Nobody knows if that's causation or just correlation. Nobody knows if that came from the virus or from the vaccine or not from the vaccine. but has caused some of those countries to be concerned. We have not seen that with the vaccines in this country. Just remind you that the serious vaccination side effects, serious would be you need some treatment of some kind, like an allergic response that requires some medication, is 1 or 2 out of 1 million doses. Now, much more get a little reaction at the site or a little fatigue or achiness or chills. Just means the vaccine's working and you're making antibodies. That's not considered a problem, and they go away pretty quickly. But serious side effects still incredibly rare. And we're also seeing a case fatality rate around the country, around Michigan, around Berrien County, that is roughly 2%-ish. And so you're still comparing 1 chance or 2 chances out of 1 million of needing some treatment for an allergic reaction, or a 2% roughly overall mortality risk. So it is benefits way outweigh the risks. And I would just encourage you, and I know Nicki does the same, is get the vaccine, whichever one is made available to you, as quickly as you can. We will fight off mutations, we'll fight off cases, we'll prevent mortality in our county the more we're vaccinated.
Oh, those are good odds. Definitely vaccination looks like it is the best choice. And as Nicki mentioned, one of the best tools we have available for us to help us walk towards the light at the end of this pandemic tunnel. So Nicki, can you just give us an overview of kind of where are things at with the vaccination rollout? It's been about 3 months now since we've been giving doses of vaccine here in Berrien County. How many have we done and where are things looking?
Yeah, I mean, these are numbers that keep going up, and we're really pleased that these numbers keep going up. But we're up to over 48,000 doses of vaccine have been administered in Berrien County, and that'll probably be about 1,000 higher by tomorrow based on today's activities. But so we're getting close to having 50,000 doses administered in Berrien County. Now, this does combine first and second doses, and we do have lots of people that have completed a 2-dose series. And this represents all providers in Berrien County as well. So not just the health department and Spectrum Health Lakeland, but we have also had a number of retail pharmacy partners. Our federally qualified healthcare centers are starting to do some vaccination. So it is a big effort. These partners are becoming increasingly important in getting the vaccine out, or playing a larger role in getting the vaccine out. As more vaccine is becoming available, we're able to fill their freezers with more vaccine so they can start getting shots in arms. On the whole, we do have 30,000 residents that have been vaccinated, either 1 or 2 doses. So that means that if we're looking at our total population of ages 16 plus, because those are technically the people who would qualify for the vaccination based on the product's age parameters, that's 24% of people in Berrien County 16 plus. And this is before we've gotten to open eligibility, which we know is on the horizon, very rapidly approaching. So I think we're doing a great job. We are administering vaccine almost as quickly as we're getting it. And I think that we're doing as good of a job as we can with the amount of vaccine that's coming into Berrien County. Just to provide a few other numbers, we have had well over 60% of Berrien County adults, 65 plus, who have been vaccinated now as well. And that's over 40% that have been completed. They've received both doses and are done. There's some more that have their second doses upcoming. We're continuing to progress through our older adults. If you're an older adult and you have not yet received your vaccine, we want to get you an appointment as quickly as possible. So we're maintaining that focus. So you can call either the health department or Spectrum Health Lakeland. We'll share those numbers with you to get that appointment, but we're continuing that priority as we continue to expand eligibility.
Wow, that's phenomenal that we've been able to make this amount of progress in a relatively short amount of time here in Berrien County. So you mentioned, Nicki, that eligibility for vaccinations is opening up pretty wide here in Michigan. Can you tell us more about what is on the horizon as far as who will be eligible in the coming weeks?
Yes, so our governor did announce recently that effective April 5th in the state of Michigan, we would like to have all Michiganders 16 and over, because that is who vaccines on the market have been approved for, would be eligible for vaccination. Now, some of the caveats there is just because everybody would be eligible for vaccination does not mean we have enough doses for everybody. You've heard us say that every time there's been a new opening of eligibility. But so starting April 5th, it's everybody 16 plus. Right now, we're in an essentially everybody 50 and older is eligible for vaccination. Starting Monday, it's people 16 plus with an underlying health condition. So trying to do a little bit of focus on some of our higher priority areas in the couple of weeks before the April 5th eligibility is open. We are going to continue to really try to have a focus on some of our higher risk people, people with underlying conditions, people of older ages, and trying to do some focused effort with our essential workers who have not yet been clearly designated anywhere and would of course be eligible April 5th. So we're working to try to balance a lot of these different priorities. But as we keep getting more vaccine into our community, it does become easier to have those multiple focus areas.
And we know that just because there is increased eligibility, it doesn't mean that we're not doing more vaccinations for the folks who have been eligible for some time. We're just continuing to roll on in that progress. So in that, there have been some recent changes from Lakeland and the health department as far as how to obtain an appointment, since we know all vaccinations are still being done by appointments. Dr. Hamel, can you tell us a little bit about what the changes look like for Lakeland's process?
Yeah, we've gone early on. We had a MyChart registration. If you had a MyChart account, that's an Epic electronic health record. That was the way you registered. And if you had a MyChart account, that was easy. If you didn't, it was very hard. We also had a backlog. A lot of folks have been scheduled and waiting to get the vaccine. We're going to be done with that backlog, and we've moved to just open scheduling. So you put your name on, pick your appointment, put your name on, and get scheduled that way. If you go to our webpage, you'll find the link there to that. I think that's going to be more convenient and a quicker way to get people registered.
Wonderful. And Nicki, how is it looking at the health department as far as our process goes?
Fairly similar. We're continuing. We're not quite through the backlog or have confirmation that everybody who's been on our 65 plus wait list has been vaccinated. So we're continuing to work through that. Again, if you have been on our wait list, you're waiting for us to contact you, you haven't heard from us or gotten your vaccine elsewhere, please call us at 1-800-815-5485. We'll get you scheduled as quick as possible, but go ahead and give us a call if you're 65 plus and still waiting. But similar to what Spectrum Health Lakeland is doing is we are having some links that are being posted on our website where people can directly schedule themselves for appointments for our upcoming clinics.
Well, that definitely sounds convenient for a lot of folks. And as you said, if people do not have internet access or might be struggling with doing that self-scheduling online, there are phone options available as well through the health department as well as through Lakeland. We'll include all this information in the chat below, in the comments below, so that you can read that as you're watching this live now or on the replay catching it later. Thank you both for that. This is exciting that we've moved into this next phase and that there's some new options available. So we know that Health Department and Lakeland have been two major players in providing vaccinations in our community, but we also know there might be some other players coming online. Nicki, can you tell us who those other entities might be?
Yeah, and I mean, they've been playing a significant role already, but we know that Meijer, Rite Aid, now Walgreens, even more so, they're all carrying the vaccine. Maybe not every single Walgreens in Berrien County, but many of them are. And we also have our federally qualified healthcare centers, which in Berrien County, that's Intercare and the Niles Family Health Center, which is part of Cass Family Clinics. So there's lots of players. It's soon going to be moving towards more primary care providers, and there will be other settings that the vaccine is becoming available. These partners are just really important because we want vaccine administration to be like that snowball. We've got it started rolling down the hill, but as it continues on, it's going to get bigger and bigger, and we need increased capacity in our community. And so far that has been going well. We're very grateful to all of our partners for all of the effort for helping to make our vaccination numbers as high as they are.
Wonderful. And since we last talked, there was a new vaccine that was approved for emergency use under the FDA, And so, Dr. Hamel, can you tell us more about that new vaccine, the Johnson & Johnson, or sometimes we call it Janssen vaccine?
Yeah,
Tell us more
Johnson
about
Johnson
that.
vaccine. So it's a little different, and it's interesting, at least to this clinician. So that vaccine is a little more like a flu shot. It is a little double-stranded DNA embedded in an adenovirus. That adenovirus is something that can't replicate in your body, but it delivers the spike protein of the COVID virus, and your body sees that spike protein and says that doesn't belong, and mounts an immune response to it. So it basically gets you ready for battle. And so if that COVID virus enters your body later on, your body recognizes it and says, let's kill it. That's much like what happens with a flu shot. Now, there's some advantages to that vaccine. That the DNA is more stable than messenger RNA, so you don't have to store it at these really, really cold temperatures, which is it makes it much more accessible to folks. In addition, that J&J vaccine is one dose, which is a real, it's a logistic advantage not to have to 3 weeks apart have exactly the right dose. And it's been very, very effective at lowering the risk for hospitalization and lowering the risk for dying, which of course is what you're trying to accomplish. So if the J&J vaccine is made available to you, I'd recommend take it. It's not inferior to a 2-dose vaccine, the Moderna or the Pfizer. It's every bit as good, and it will give you the protection you need. So we're excited to have that vaccine available.
So 1 dose and really effective. That sounds like awesome. Nicki, is that available for Berrien County residents yet?
TBD. So yes, there has been an initial allocation of the Johnson & Johnson doses to the health department. We have reallocated some of those doses to Spectrum Health Lakeland. So there are some clinical settings where that is becoming available. It is more likely, and our guidance from the state and really from the CDC at this point have been to use that Johnson & Johnson vaccine in settings where it's going to be really difficult to have people return for a second dose. So there's some clinical settings where that has made a lot of sense. There are some populations and some limited use within some essential workers that has really made a lot of sense to implement this 1 dose while it is in such a low volume. We do expect to start receiving regular allocations of Johnson & Johnson starting next week. So it will become more available. We do intend to hold some community clinics because we know there are people that want this one specifically for a variety of reasons. So we will be holding some clinics with that product. That being said, though, we want to go back to what Dr. Hamel said. We need people to be ready and willing to take whatever vaccine is available to them when it's your opportunity to be vaccinated. Yes, there are some things that are wonderful about having just 1 dose, but there are also some really important things of getting that 2-dose series as well. And logistically, how we're able to organize clinics with what product, a lot of it has to do with what we have available to us and what we can predict is coming to us when we're setting those clinics. So we appreciate your flexibility with that as we work to make sure we have an appropriate complement of those products in our community.
Well said. So, that really kind of concludes a lot of the questions that we had for today. Dr. Hamel, do you have any closing thoughts before we end?
Well, I am grateful to all of you in Berrien County for tuning in, for caring about your friends and neighbors enough to protect yourself and help protect them. I encourage you, despite the warm weather and the spring fever that we're all going to experience, if we are diligent a few months longer, if we're careful about our hand hygiene and our social distancing and our masks and our social bubbles, if we're careful a little longer, we're going to save lives. And of course, that's what I want to do every day. And I'm sure that's what you want for your family and you want for your friends and neighbors. So please be careful. And I also say, please get your vaccine. If you have questions or concerns about that, talk to folks at the health department, talk to us. We're happy to talk to you about that vaccine. We're not going to twist your arms. We want to save your lives. That's what we're trying to do.
Yeah. Nicki, anything to add?
Yeah, I mean, a few things I would add. So, one, we do have plenty of volunteer opportunities. If anybody continues to wish to say, you know what, that's really meaningful work. I've got a few spare hours that I'd love to be able to spend at a clinic helping my community get through this pandemic. There's opportunities. So you can sign up. We have a common form at both the health department's website and Lakeland's website. So if you want to volunteer with either or both of our organizations, that would be great. Go ahead, check that out, take a look, but we have opportunities every week for people to participate, and there will be some new roles coming too. So we've got ones that are more public facing. We have opportunities that are not as public facing as well. So check that out. And then I also just want to take just a quick moment to reflect on, we're here in mid-March, whereas so much in life changed mid-March a year ago. We're within days of the first COVID case being identified, or the 1-year anniversary of the first COVID case being identified in Michigan, and then a few days later in Berrien County. And I think it's good to make sure that we pause for a minute and just kind of reflect on what has happened in this last year. So I would encourage you to really think about how you've grown, how our community has grown, mourn the things that we've lost, and really be doing some of that reflection so that we are prepared as we're starting to think about emerging on the other side of this, that we can be really intentional about the community we're trying to build and that we want to live in and that we want to be part of.
Wonderful words of hope and healing, lots of things on the horizon for us to look forward to. And as always, that reminder to stay diligent in the preventative actions that we've been taking now for a year here, and making sure that we are able to keep transmission levels low while that vaccination rollout continues. Thank you both so much for joining us today, and for you as well who have joined here on Facebook. Again, you can find a lot of information that we covered today on our respective websites. That's bchdmi.org/COVID-19 and spectrumhealthlakeland.org/vaccine. We'll drop those links here as well. Thank you so much for joining us.
Thanks.